sitting in my office at University College London in 1986 when a force of nature appeared in my office, and that was Fraser Mustard. And Fraser asked me about the Whitehall study, excuse me, about the Whitehall study, and I showed him the social gradient in mortality. And Fraser said, this has profound policy implications. And I said, Fraser, Mrs. Thatcher is Prime Minister. This is pure research. It has no policy implications whatever. Fraser said, you've got to come to Canada because it has policy implications in Canada. So he invited me, the pop health group of the Canadian Institute for Advanced Research was just getting going, and he invited me to come to a meeting. So what do you want me to do? He said, well, it's rather informal. You've got an hour. Start at 11 and go to 12, and then we break for lunch, and you're welcome to stay for the rest of the meeting. So I started at 11. At, I would say, 90 seconds after 11, Clyde Hertzman asked me a question. But when Clyde asks you a question, that's not like anybody else asking you a question. That's somehow penetrating to the core of your being. At 5 o'clock in the afternoon, I was still talking because I'd get a bit further and Clyde would be, I need to understand this, said Clyde. I need to understand what this is all about. And Clyde, Michael Wolfson, Bob Evans, the people in that network really bought into it. I'd never had an experience like it in my life. And they said, the social gradient, we're convinced that's what we've got to do. And then Fraser said to me, have you thought about early child development? And I said, Fraser, I'm studying civil servants. They sprung fully formed with umbrellas and bowler hats. They had no childhood. Well, Clyde took the bit between his teeth, and as everybody has told you, and you all know, he ran with it. So when it happened several years later that I was asked to chair the WHO Commission on Social Determinants of Health, we convened 9 knowledge networks. We said we wanted the best people in the world to get together in networks, and we wanted networks. We wanted North-South partnerships, the best knowledge from all over. And we convened 9 knowledge networks. I decided what the areas were, and the first was early child development. And I'd always wanted Clyde to work with me and for me with him. So I invited Clyde to convene the Knowledge Network on Early Child Development. And I would say that it's probably fair to say that I bequeathed Clyde the gradient, and he bequeathed me the importance of early childhood. And I've become an advocate. I'm not a passive consumer, an active consumer of other people's research on early childhood. It's not the area that I personally have been involved in researching, but I've been very much involved in taking the knowledge that Clyde, with the Knowledge Network on early child development, brought to us. And I would say Clyde's fingerprints are all over the report of the Commission on Social Determinants of Health, in a good way. And Fraser was absolutely delighted that our first substantive chapter in the report was equity from the start. And that's Fraser and that's Clyde. So I'm so enormously grateful for what I've got out of this relationship that's gone on since this force of nature turned up in my office in 1986 and said, we've got to explore the policy implications of your research. And I would say that's what got me into doing what I'm doing. The report of the Commission on Social Determinants of Health was published in 2008. And we called that report Closing the Gap in a Generation. I heard a few moments just before the break that could be interpreted that people were saying, oh, things are difficult, why aren't we making more progress? My approach is completely different, which is I don't point to the countries or the districts or the areas where we're not making progress. I point to the ones where we are. And we are making progress. And I'll show you a few examples where countries have taken on board what we said, that we could close the gap in a generation. Now, I spent my life as a researcher, but I said we have the knowledge to close the gap in a generation. We have the means to close the gap in a generation. What we now need is the will to close the gap in a generation. And in the light of the WHO Commission, which was for all countries everywhere, I was asked in Britain, how could we translate the findings of your WHO Commission into a form that would be suitable for one country, England, in order to address health inequalities? And I called my report Fair Society, Healthy Lives. It was a bold claim that if we put fairness at the heart of all policy making, health would improve and health inequalities would diminish. One of the questions that's reasonable to ask is anybody listening? In England, 3/4 of local authorities have Marmot implementation plans. I met a local councillor from Manchester, and she said, "You're Marmot. I didn't realize Marmot was a person." We talk about implementing Marmot. That's what we're doing up in Manchester. So what's happening at the national level is not altogether favourable in terms of action on social determinants and health inequalities, but there's action at local level, and I'll show you a further example of that. And then I was invited by Susanne Jacob, the director of the Regional Office for Europe at WHO, to conduct a review of the European Review of Social Determinants of Health and the Health Divide. And we published that, we launched it in London in October last year, trying to get on the agenda of 53 member states that make up the WHO European region. I was trying to explain to Americans about the WHO European region, that it's the whole of the former Soviet Union. I said to them, it goes so far to the east, you can practically touch Sarah Palin. And I don't share your amusement at that prospect. You'll recognize this. It's my simplified version of Clyde's big model that he did for the knowledge network of the Commission. We were invited to do a review of the evidence by one of the children's charities that was providing services for children. And we said, okay, if you want to improve outcomes for children, you've got to look at children's health and development, you've got to look at parenting, and you've got to look at the context in which parenting takes place, parents' lives. So you can see where my intellectual debts are, where we get those ideas from. This is one way of why it matters. This is from our European Review of Social Determinants and the Health Divide. I have to explain, EE is Estonia, SE is Sweden. There is a rumor going around Europe that there's a Swedish paradox, that, as one researcher said, Sweden's doing everything Michael Marmot recommended and they still have huge health inequalities. Well, I look at these data and say, what Swedish paradox? They've got the longest life expectancy at age 25. Of these countries, and pretty narrow inequalities by education. I apologize for this, ISC, that's low education and high education. There's a second message. The variation in mortality, in life expectancy, is much bigger for men with low education. If you've got high education, you can just about get away with living in Estonia or Hungary or Romania or Bulgaria. If you've got low education, you can't. So there's a difference of where you find yourself, that the consequences of having low education matter much more in some countries than in others. And that tells us that we can potentially do something about the social gradient. It's shallower in Sweden than it is in Estonia and Hungary and Romania. We can do something about it. Why am I sharing this now? Well, we're talking about early child development. Early child development, as you've heard all day, is absolutely key in determining educational levels through the life course. Early child development, readiness for school, what happens through the school system, education. Whether it's the education per se, or as Clyde talked about, accumulation of advantage and disadvantage through the life course, early child development, education, and then what education predicts in terms of income and living conditions and so on, is an important question. Our own analyses of these data suggest education probably is important, along with other things. But it's showing you how important education is right across Europe. And there's the data for women. The differences are smaller. The gradient is shallow for women. I want to touch on 3 levels of action, which I could call macro, meso, and micro. You saw a version of this from Neil Halfon this morning. This was the previous report card from looking at the OECD countries and looking at country ranking in equality in child well-being. The Minister of Health from one country said in a WHO context, when I was presenting results from our European review, I don't think WHO should be involved in social determinants. Health is a matter of individual responsibility. It's not for WHO to get involved in social things. And I said, you can blame adults, perhaps, for their lifestyle, but don't blame the children. They didn't choose to be born in poverty. They didn't choose their parents. You're going to blame, in some biblical fashion, the sins of the parents will be visited on the children unto the 4th generation. Let's give our kids a fair go. And I'd say Canada gets a B-. The United Kingdom gets a C. And I do like lecturing in the United States. Can we do anything about this? Here, child poverty is defined as having less than 60% median income. And we're looking at child poverty before and after taxes and social transfers. Compare, for example, Latvia and Sweden. Before taxes and transfers, child poverty in Latvia is 35%, in Sweden it's 32%. After taxes and transfers, in Latvia, it's still around 25%. In Sweden, it's 12%. In Slovenia, it's even lower. Clearly, the Swedes and the Slovenians are intolerant of child poverty. They run their system to have lower levels of child poverty. That will have an impact on everything we've been talking about today. I was speaking at the opening session of the American Public Health Association meeting in the beginning of November. 7,000 people in this vast football stadium. I said, how's the US doing? And I showed them the data. The US looks worse than Latvia. And I said, you have a democracy. This must be the level of child poverty you want. Otherwise, you'd vote a government in that had a lower level of child poverty. Harvey Feinberg, president of the Institute of Medicine, said to me, do you think you'll get asked back? And if we look what's happening in Britain, look at the blue curve, which is the UK. I've got Northern Ireland separately, but just look at the blue curve. The dotted line is what would have happened to child poverty without the fiscal changes that the current government has made. The solid blue line is child poverty because of the fiscal changes, the tax and benefit reforms that the current government has made. And I've shown this to cross-government department of officials, and I've said, clearly, government policy is increasing child poverty. That will, other things being equal, have an adverse impact on early child development. And the government's response to that is to put out a consultation to change the measurement of child poverty. And I said that may benefit politicians, that will not benefit one single child in the country. I probably won't get asked back there either. And family policy generosity makes a difference to child poverty. This is from our Nordic Knowledge Network. USA, Australia, Ireland, UK, Canada. It's very bad for you. This is a political statement in this country, I know. It's very bad for you to be in an English-speaking country because you have high child poverty levels. It's clear. Family policy generosity is greater in Sweden, Norway, and Finland, and they have lower levels of child poverty. And the way that might work is allowing two parents to go out to work and subsidize childcare. Preschool education, we know, is important, and looking right across Europe of the countries where children are not getting access to preschool education. It's a soluble problem, and it's not being solved. I think I may have got this from Clyde, actually, looking at enrollment in preschool in Cuba and other Latin American countries, and reading levels in 6th grade. So it's looking at the percent of children getting at the high level of reading in 6th grade. And Cuba, which has the highest enrollment in preschool, has the best reading scores in Latin America. And the lower the enrollment in preschool education, the lower the reading scores in these different Latin American countries. Cuba's not the richest of the Latin American countries, but it's got the highest enrollment in preschool and the best reading scores at that age. And we can see a difference in PISA scores, the Program of International Student Assessment, by whether or not children had a year or more of preschool education. So at age 15, there's better scores on maths, literacy, and science if children were enrolled in preschool than if they weren't, after accounting for socioeconomic background. So profound effects. And I showed you the graph on education and mortality, and I said, this is a manifestation of this life course effect of early child development, what happens preschool, what happens in schools. I have to show you this. It's sort of departing slightly because I get asked commonly, are there examples where people have reduced the gradient, where they've made a difference? This is stunting by family income in Brazil for different years of surveys. So 1974, 5 at the top, and 2006, 7. Stunting by family income. They have closed the gap. They've made the gradient shallower. They've really done it. It's possible. I could show you under 5 mortality in Bangladesh. They've reduced the social gradient in under 5 mortality in Bangladesh. So it's not the case that inequalities are always getting bigger. They are in some cases, but we've got important and inspiring examples where the social gradient can get shallower. Meso level. Sweden's interesting. I was giving a lecture in Sweden last year, and a parliamentarian said, you know, most reports get forgotten. Your WHO Commission report is still being discussed in the Swedish Parliament 5 years later, and you have to come to the Parliament. So I went to the Swedish Parliament, and I said to them, with respect, if you were not just discussing it, but doing something about it. And then I told them I had the previous day addressed the Swedish Association of Local Authorities and Regions, 300 people representing local authorities from all over Sweden, who were all developing plans to implement the WHO Commission on Social Determinants of Health. In Malmö, they read the WHO Commission. They said, our national government's not doing anything about it. We'll do it in the city of Malmö. And it was set up by the deputy mayor, not by the health people. They asked me when they finished in Malmö, I was sort of the padrone of the Malmö Commission. They said, what should we do now? I said, get on the road and talk about it. Tell everybody in Sweden what you've done. And they have been. And their 6 areas for action were very similar to our WHO and my English review. You saw this in Neil's slides, just an example of the social gradient. When somebody from McMaster's said this morning, what about a living wage? And what I wanted to say was, look, if you look by quintiles of income, it's a gradient. Yes, we've got to deal with poverty. Yes, we've got to deal with a living wage. But we want everybody to have the level of early child development that's available to the best of. Hence the whole idea, and thank you, Michelle, before the break, for talking about proportionate universalism. That's why we talked about proportionate universalism. We want universalist policies. We want everybody to get up to the top level, but we may have to work harder the more deprived. And again, Clyde was a great influence on me, the importance of monitoring. After we published the English review, on the 1-year anniversary in 2011, on the 2-year anniversary, and we'll do it again this year on the 4-year anniversary, we published a set of indicators, the Marmot indicators, and one of which was the percent of children age 5 achieving a good level of development by level of affluence and deprivation of local authorities. And what you can see is the more affluent the local authority, the better the level of early child development. I presented this in the British Parliament, and some joker said, I think the proportion of variance explained would be quite low in that correlation. I thought that's what MPs most want to discuss, the multiple R squared. I said, what the gentleman was trying to say is there's variance around the line, which suggests 2 strategies. One is reduce poverty. And I've shown you examples of how fiscal policy can make that better or worse. But the second is to ask the question, why, for a given level of affluence and deprivation, some are doing better than others? And I was invited to Birmingham, the English city of Birmingham. They said they had 6 Marmot champions, 1 for each of my 6 domains of recommendations. And they had 1 on early childhood. And what they were doing, we heard a lot before about learning from experience. What they did was they took off the shelf programs that had been evaluated elsewhere of proven effectiveness, and they applied them. And what happened? Birmingham is more deprived than the English average. So if you look in 2007, the level of early child development in Birmingham, as predicted from the level of deprivation, was worse than the English average. And look what happened in 3 years. Look what happened in 3 years. They closed the gap in 3 years. Wow. It is rocket science. They took some evaluated programs and they applied them. And they worked. Can make a difference. That's pretty good. Why am I showing you this? My new friends are the firefighters. I went to Merseyside, Liverpool. This is West Midlands, where Birmingham is, because West Midlands wrote and said they wanted to become partners with us, the Fire and Rescue Service. I went to Liverpool, and the firemen adopted me, captured me or something. They took me to a fire station, and they said, we're all macho white men. And we'd go off and fight a fire, and somebody would have died, and we'd come back and we'd say, what a tragedy. They really shouldn't have happened. Somebody should have done something about preventing that fire. And then they said, somebody should have done something. Maybe we should have done something. We spend 6% of our time fighting fires. The other, they play poker or whatever they do the rest of the time. Why shouldn't we do it? So they went into people's houses and talked about fitting smoke alarms. And while they were there, people would say, smoke alarms, I've got a leaky roof. And these burly, macho white men became social workers. They say, you know, you can get a grant from the local authority to fix your roof. We can help you do that. And then they said, do you know who dies in fires? You know, mentally ill, heavy smokers, alcoholics, so on. So we better get people not to smoke in bed. And then they said, while we're up, why don't we try and get people not to smoke? And then they gave older people cards so they could get into the gym and the fire station, so older people could come and exercise. Then they got the kids, and they teamed up with Liverpool Football Club, and they got the kids off the street and got them playing football. And then they got them in, they'd say to the kids, do you want to come in and play in the fire engine? When you go to Liverpool, they say this area right here is the most deprived in Britain. I went to 17 of those that were supposed to be the most deprived in Britain. So they go to this deprived area, they get the kids in, and the kids say, what are those things in the ground? And they say, they're vegetables. Vegetables? What do you do with them? You eat them. Really? Green things? So they got the kids growing vegetables. And the West Midlands, they've been taking kids off on these adventure things. It's great. So the year I spent as president of the British Medical Association, I said to the GPs, do you know what the firefighters are doing to address social determinants of health? What are you doing? So we produced a report on what health professionals could do to address social determinants, education and training, working with individuals and communities, the NHS as employer, improving working conditions of employees, working in partnership with others, early child development, and being advocates for better social policy. We got 19 health and medical organizations to give us written commitments, the Royal College of Physicians, the Royal College of Psychiatrists, of GPs, the obstetricians, the physiotherapists, the midwives, the nurses, all signed up to what they would do on social determinants. And micro. It's like Clyde's expanding diagram, although I'm coming in. What happens at the family level really matters. There's the social gradient and socio-emotional difficulties at age 3. In the Millennium Cohort Study, we classified parents on their parenting activities and various psychosocial inputs. And what you can see is you can statistically explain about half the gradient in socio and emotional difficulties at age 3 and at age 5 by parenting activities. You can make a difference to the social gradient. And working outwards, parenting activities are, as I said right at the beginning, influenced by the context in which parenting takes place. Thinking about our European review, with these 53 countries, the whole of the former Soviet Union, countries are at a very different level in terms of what they are doing and what they feel they can do in terms of social policy. So we said, if you're doing nothing, do something. It makes a difference. It would make a difference in Kyrgyzstan, in Kazakhstan, if you did something. If you're in Poland or the Czech Republic and you're doing something, do more. And we've given you the evidence on what you can do. And if you're in Sweden, do it better. Because as everyone has said today, we think we have the knowledge to make a real difference. And the reason we should be making this difference is to create fairer societies.